You know that feeling when you're just drowning in
Yeah.
information? You need to get a handle on something important, something complex, but everything you read just adds more noise.
Oh, absolutely. We've all been there, especially now, right? Cutting through all that to find what really matters is, well, it's essential.
And that's exactly what we're trying to do here. In this deep dive, we want to get straight to the core insights on a massive global health issue, type 2 diabetes.
Hmm.
We're going to unpack what really helps or hinders people with T2D when it comes to their health behaviors. And we're basing this on a really interesting new qualitative study from 2025 done in China.
Yeah, and this is important for you, the listener, whether maybe you're dealing with this yourself or perhaps supporting a family member, or maybe you just want to understand a health challenge that affects literally millions of people worldwide.
Exactly. Our main source here is a detailed study. It was published in the Science of Diabetes, Self-Management and Care. The paper is called Facilitators and Barriers of Health Behaviors in Patients with Type 2 Diabetes, a qualitative study by Liu and colleagues. So let's get into it.
Okay, so before we jump into the study's findings, it's really important to grasp just how big of a deal type 2 diabetes is. Basically, it's a chronic metabolic disease. Your body struggles with insulin, either doesn't use it right or doesn't make enough, leading to high blood sugar, hyperglycemia.
And the numbers, I mean, they're really quite staggering, aren't they?
They are. The International Diabetes Federation, the IDF, reported that back in 2021, 537 million adults around the world had diabetes. That's huge.
Wow, 537 million.
Yeah, it works out to about 10.5% of adults globally, roughly 1 in 10.
And it's not stopping there.
No, unfortunately not. The projections are pretty sobering. The IDF thinks it could hit 783 million by 2045.
783 million. That's potentially 1 in every 8 adults on the planet.
Exactly. And if we zoom in on China, where this study took place, the picture is particularly stark.
How so?
Well, China currently has the highest number of adults with diabetes anywhere in the world. The prevalence rate is up around 11.2%.
Okay.
But what's really eye-opening is the speed of the increase. Between just 2011 and 2021, so a single decade, the number of patients shot up from 90 million to 140 million.
That's a 56% increase in 10 years.
A massive 56% jump.
Yeah.
And they're projecting it could reach nearly 175 million by 2045 in China alone.
So the scale is just immense. But it's not just about the numbers, is it? The consequences of not managing T2D well are severe.
Absolutely. Poor blood sugar control isn't just about feeling off. It can lead to really serious life-changing complications. Things like infections that won't heal, kidney failure, blindness, even lower limb gangrene.
These aren't just medical terms. They're things that cause major disability, shorten lives.
And they place a huge burden, not just on the patients and their families, but on healthcare systems and society as a whole. The economic costs, the social costs, they're significant.
Which is why you hear so much about self-management, right? Guidelines everywhere stress how crucial it is for patients to manage their diet, exercise, blood sugar monitoring.
Exactly. That's the standard recommendation. It's seen as fundamental for controlling the disease.
But here's the kicker, isn't it? Despite everyone saying how important it is, the actual follow-through, it's often not great.
That's right. That's where things get really interesting. Studies consistently show that adherence is, well, suboptimal. For dietary guidelines, maybe around 57% adherence.
Only 57%.
Yeah, and for blood glucose monitoring, it's even lower, like 48%. Exercise is similarly just under 50%.
So there's this big gap between what people should do and what they're actually doing.
A huge gap. And that raises the fundamental question, why? Why aren't people adhering more consistently, especially given the risks? And that's precisely the question this Liu study from 2025 tried to answer.
Okay, so the main goal of this study was really to dig deep into the patient's own experiences, to understand from their perspective what actually helps them stick to healthy behaviors and what gets in the way.
Exactly. They wanted insights to help design better support programs, better interventions.
How they go about it.
They used what's called a qualitative descriptive research design. So it wasn't about crunching numbers, but about gaining in-depth understanding. They did interviews, detailed interviews, with 25 patients who have type 2 diabetes.
Right, to get those lived experiences. And they used a specific framework to analyze this, didn't they? Something called HAPI.
Yes, the Health Action Process Approach, or HAPI theory. It's a model developed by German psychologist Ralf Schwarzer. Think of it like a roadmap for health behavior change.
Okay.
It emphasizes how our thoughts, feelings, and actions all interact, and it breaks the change process into phases. The pre-intentional phase where you're just starting to think about it, then the intentional phase where you form the intention and make plans, and finally the action phase where you actually do it and try to maintain it.
So IPA highlights things like planning and self-belief, self-efficacy.
Precisely. Planning and self-efficacy are key components. Using HAPA helps the researchers pinpoint where in this process things go right or wrong for patients. It gives us a really useful structure for understanding the facilitators and barriers they found.
Got it. And where do they find these patients?
The study was run through an internet hospital platform in China. They used purposeful sampling, basically meaning they carefully selected participants to get a good mix. Different ages, genders, education levels, how long they'd had diabetes.
So the diverse group.
Yeah, the average age was around 57, 58. There were 10 women and 15 men involved.
Okay, so they did these in-depth interviews, analyzed them through the HAPA lens. What did they find? What actually helps patients engage in these crucial healthy behaviors?
Well, they identified 9 key facilitators, and you can kind of group them into a few categories. There are the cognitive drivers, the sort of mental motivators, then there's the planning and doing part. And finally, things related to belief, resilience, and external support.
Let's start with those cognitive motivators.
Yeah.
What drives people early on in that sort of pre-intentional stage?
Right. 3 big ones stood out here. First is risk perception. This is all about how much patients truly grasp the seriousness and the likelihood of diabetes complications.
So understanding what could actually happen.
Exactly. Like one 64-year-old woman talked about being really worried about losing her sight or getting diabetic foot. Another participant, a 59-year-old man, was very motivated because his father had actually passed away from diabetic kidney disease, diabetic nephropathy.
Wow, that's powerful personal experience.
It really is. It makes the risks feel real, not just abstract warnings. That awareness can be a huge driver for change.
Okay, so risk perception is one. What else?
Second is outcome expectations. This is what patients anticipate will happen if they adopt healthy behaviors or if they don't.
So thinking about the results.
Yes. Positive expectations could be things like, okay, if I do this, my blood sugar will improve, I can reduce my risk of complications, I might live longer, or even just, as one patient put it, live like a normal person.
Mm-hmm.
But negative outcome expectations are also powerful motivators, like a 72-year-old man who worried about having a hypoglycemic episode, low blood sugar while driving, maybe causing an accident, or fearing unstable blood glucose or even ketoacidosis from not managing things well. Both hopes and fears play a role.
Right, the carrot and the stick, in a way.
Kind of, yeah. And once patients really understand their risks and anticipate these outcomes, that leads to the third cognitive factor, intention.
The decision to actually do something.
Exactly. It's that conscious willingness to change. It marks the real starting point. Like that 53-year-old participant who said, after understanding things better, he was now determined to treat it as a significant priority. That's the spark.
Okay, so you've got the intention. What comes next, according to the study and the HAPA model? This is moving into the planning stage, right?
Right. The intention needs to translate into concrete plans. So 2 key facilitators here are action plans and coping plans.
Action plans. That sounds like specific steps.
Yep, specific strategies, timelines. Like one man, 46 years old, planned to get his glycated hemoglobin tested every 3 months. Very specific. Another, a 65-year-old, had a clear plan. Walk over 15,000 steps a day and jog for half an hour to manage his weight. Concrete goals.
Not just I'll exercise more, but how and when.
Precisely. But just having an action plan isn't always enough because life throws curveballs, right? That's where coping plans come in.
Okay, so how to deal with difficulties.
Exactly. Strategies to overcome challenges or temptations. There was a great example. A 34-year-old man who really loved eating rice, which can be tricky with diabetes. So his coping strategy was to buy a special rice cooker designed to lower the glycemic impact. And it worked. He could still enjoy rice sometimes while keeping his blood glucose levels good. That's smart coping.
That is clever.
Yeah.
Finding ways around the obstacles.
Yeah.
What about internal factors like belief?
Hugely important. Self-efficacy was a major facilitator. That's basically your belief, your confidence in your own ability to succeed.
And the study broke that down.
It did, into different types. There's action self-efficacy, believing you can start the behavior, like a 46-year-old woman who was confident that her daily exercise was effectively controlling her blood sugar.
Okay.
Then there's maintenance self-efficacy, believing you can stick with it over time. A 60-year-old man talked about adapting to a new diet, even though he preferred white rice, saying, I believe I can keep going.
Right, keeping it up.
And finally, recovery self-efficacy. This is crucial. It's believing you can get back on track after a setback. Remember that 46-year-old man who planned his tests? He actually had a biking accident.
Oh, no.
But he recovered and immediately started exercising again. He had the confidence that he could resume his routine even after a disruption. That's recovery self-efficacy in action.
That resilience is key. Now, you mentioned some new facilitators identified in this study, things not typically highlighted in HAPA.
Yes, and this is really interesting. One was emotional regulation, managing difficult emotions, anxiety, depression, fear, even the stigma sometimes associated with diabetes to stay positive.
How did patients describe that?
One 51-year-old woman said she had to constantly adjust my emotions to cope with having diabetes. Another poignant example. A 73-year-old woman mentioned turning to sweets for comfort after her wife passed away, showing how emotional states directly impact health choices.
Right, and stigma, too.
Yes, a 41-year-old woman felt embarrassed taking her medication when she was out with friends. Managing those feelings is a real active part of managing the condition for some people.
That makes a lot of sense. What was the other new one?
A proactive and sustained sense of responsibility. This goes beyond just following doctor's orders. It's about patients actively seeking knowledge, monitoring their own health closely, really taking ownership.
Like being their own health detective.
Sort of. A 60-year-old man emphasized paying attention to his condition and monitoring. Another, a 65-year-old, didn't just monitor, he actively analyzed why his blood sugar might be off.
Trying to understand the patterns.
Exactly. And that 46-year-old cyclist summed it up brilliantly with an old saying, know yourself and know your enemy, and you can win 100 battles. That really captures that proactive, empowered mindset.
I like that. And the final facilitator.
Yeah.
Also a new one.
Yes, and it's a big one. Multidimensional social support. Basically getting help and encouragement from various sources.
Like family and friends.
Yes, family, friends, but also the community and healthcare professionals. That 60-year-old man saw the online hospital staff almost like family doctors. A 65-year-old mentioned his family reminding him about his diet if his sugar was high.
Community support, too.
Definitely. A 66-year-old woman talked about community activities, diabetes, education sessions, group walks, fostering mutual encouragement. And another woman mentioned getting great peer support from a fellow patient, a Mr. Zhang.
So it really takes a village, in a way.
It really does seem to. That network of support seems indispensable for many people navigating this.
Okay, so those are the forces helping people move forward. But of course, it's not always smooth sailing. What did the study find were the main barriers, the roadblocks that make it so hard for people to stick with these healthy behaviors?
Right, the flip side of the coin. And this is where it gets particularly insightful, because the study identified 9 key barriers, and interestingly, all 9 were considered newly identified within the context of the HAPI framework.
All 9 were new in this context.
Wow. Yeah, it suggests that maybe our previous models were missing some really crucial real-world obstacles that patients face daily. It points towards needing new strategies for intervention.
So what are these barriers? Where should we start?
Well, similar to the facilitators, some relate to knowledge and beliefs, fitting into that pre-intentional stage again.
Okay, what kind of gaps did they find?
First, insufficient disease awareness. This isn't just about not knowing facts. It can be a deeper lack of understanding or even difficulty accepting the diagnosis itself.
Like denial.
Sometimes, yes. One 41-year-old woman shared how she struggled with why I had to get diabetes. Others might lack awareness of just how important self-management is. Or, like one 67-year-old man, they might simply not believe in things like diet control, prioritizing freedom over the disease dictating their life.
And family influence can be a barrier, too.
Definitely. A 54-year-old man admitted he didn't take his diabetes seriously initially because his mother, who also had it, didn't seem to manage it strictly. So family attitudes matter, for better or worse.
That's a critical barrier right at the start. What else falls under knowledge and belief?
Low self-efficacy. This is the opposite of the facilitator we discussed. It's a fundamental lack of confidence in one's ability to manage the disease.
So feeling overwhelmed or incapable.
Exactly. That same 41-year-old woman sighed and said she had no confidence, feeling like no amount of money can treat this disease. Just a sense of helplessness. The 54-year-old man confessed, I don't think I can fully control my diabetes. That belief really undermines any effort.
And alongside that, just a basic lack of how-to knowledge.
Yes, a lack of disease management knowledge. Not understanding the practicalities. This leads to confusion, poor choices, poor control. A 62-year-old man thought after his diagnosis that he couldn't eat anything. Just a complete misunderstanding.
Which must be incredibly stressful and hard to follow.
Absolutely. And a 50-year-old woman put it plainly, we really don't understand our condition very well. That highlights a real need for clear, practical education.
Okay, so those are knowledge and belief gaps.
Mm-hmm.
What about the barriers related to actually doing things in the action stage, daily life challenges?
Right. One major barrier here is insufficient self-control, difficulty resisting temptations or breaking long-standing unhealthy habits.
Like cravings?
Yes. A 67-year-old woman admitted she just can't resist her favorite foods, even knowing she shouldn't. For others, it's inertia. A 61-year-old man stopped exercising simply because he got too busy.
Habits are hard to break.
They really are. And sometimes cultural norms interfere, like a 66-year-old woman who would eat more than planned just to avoid wasting food, that thrift mentality, clashing directly with dietary needs.
That's very relatable. And social situations must be a minefield.
Absolutely. The impact of social activities was another big barrier. Dining out, parties, unavoidable work gatherings. They disrupt routines and make it incredibly hard to stick to dietary plans.
Peer pressure or just the environment?
Both. Often. One 53-year-old man talked about indulging at unavoidable social meals. It's tough to be the odd one out or navigate food choices in those settings.
Okay. What about more physical or environmental roadblocks?
That falls under accessibility of personal conditions. This is a broad category covering things like poor physical health limiting activity, lack of time due to work or family, an unsafe environment for exercise, or even struggling to adapt routines in new places, like during travel.
Can you give some examples?
Sure, that 54-year-old man had joint pain from past exercise attempts, making him reluctant to try again. A 73-year-old woman had leg bursitis, making walking difficult. The 66-year-old woman wouldn't exercise if it was raining outside.
So practical limitations.
Very practical. And sometimes it's about disruption. Remember the 34-year-old man with the rice cooker? He actually stopped taking his insulin during a trip and just never got back into the habit of taking it afterwards. A temporary disruption became a permanent barrier.
Wow. So even if you have the knowledge and intention, these things can completely derail you.
They absolutely can. And linked to that is a lack of problem-solving skills, the inability to see a problem and figure out a workable solution.
Like the woman struggling with portion control.
Exactly. That 67-year-old found choosing the right foods and portion sizes very difficult, suggesting she lacked strategies to manage it. Another man called diet management the most troubling aspect, implying he couldn't find effective ways to handle it.
And sadly, for some older patients, another barrier emerges.
Yes, cognitive decline. Age-related issues with memory or thinking can really impact adherence, especially with complex medication schedules.
Getting medication.
The 73-year-old woman mentioned sometimes forgetting her meds if her routine was disrupted, like waking up late or going out unexpectedly. It's a significant challenge for managing a chronic condition that requires consistency.
And finally, just as support helps, the lack of it hinders.
Absolutely. The last barrier is simply a lack of social support. Not having that help from family, friends, community, or even healthcare professionals.
What did that look like for patients?
Well, one 67-year-old woman described her husband as very selfish, not supportive of her needs. Another, a 50-year-old woman, felt her family just didn't understand her condition and were too preoccupied with their own matters.
That sounds incredibly isolating.
It can be. Feeling alone while trying to manage a demanding chronic illness is a huge barrier to success.
Okay, so if we pull all of this together now, connecting it back to that HAPA framework.
Right. You can see how facilitators like perceiving the risk, expecting positive outcomes, and believing in your self-efficacy, they really ignite that initial intention to change.
That's the spark.
Exactly. Then that intention needs to be channeled into concrete action plans and coping plans. Those are vital for actually starting the new behaviors.
And then to keep it going.
That's where things like emotional regulation, managing the ups and downs, and that proactive sense of responsibility becomes so important for maintaining the behaviors long term.
And if you stumble,
Recovery self-efficacy helps you get back up. Believing you can recover from a lapse is key to preventing a temporary slip from becoming a permanent relapse.
and weaving through all of this.
Is social support. It seems to be, as the study put it, an indispensable factor throughout the entire journey. It supports initiation, maintenance, and recovery.
So this isn't just academic. What are the practical takeaways? What does this mean for healthcare professionals trying to help patients, and for you, the listener, understanding this process?
Well, the big implication is that interventions need to be tailored. A one-size-fits-all approach clearly isn't enough. We need stage-specific strategies.
Okay, so for someone in the initiation stage, just starting out, maybe newly diagnosed or newly motivated, what should the focus be?
For initiation, it's really about building that foundation. Boosting self-efficacy is crucial. Helping patients believe they can do this. Clear education on the benefits of action and the real risks of inaction severity, likelihood is key.
So building knowledge and confidence.
Yes, and making sure health education is standardized and easy to understand. Also, considering their physical environment, are there safe places to exercise? Access to healthy food, and guiding them in creating those specific action and coping plans we talked about.
And involving others.
Critically important at this stage. Bringing in family, maybe connecting them with community resources or peer support groups right from the start can make a huge difference.
Okay, that makes sense for getting started. What about the maintenance stage? For people who are already trying but maybe struggling to be consistent.
Here, the focus shifts a bit. It's about reinforcing that sense of personal responsibility and encouraging them to become active learners about their condition, empowering them to problem solve.
Helping them navigate challenges.
Exactly. Guiding them on how to communicate their needs in tricky social situations, like dining out. Helping them develop better self-control strategies for temptations. Also, regularly checking in on their mental health and emotional state to support emotional regulation.
And considering things like cognitive decline.
Yes, especially in older patients. Screening for cognitive issues and adapting the management plan if needed, maybe simplifying medication routines, using reminders becomes important for sustained adherence.
So by taking this more nuanced, stage-specific approach, the hope is to move beyond just giving advice.
And actually empower patients with the specific tools and support they need at each point in their journey, ultimately leading to better self-management, better health outcomes, and hopefully a better quality of life.
It really underscores the need for healthcare to be more adaptable and person-centered, doesn't it?
It really does.
So this deep dive has really laid bare how complex managing type 2 diabetes is. It's not just about knowing the rules of diet and medication. It's so much more about these internal drivers, our beliefs, our emotions, and the external forces like our relationships and our environment.
A very human challenge.
Definitely. And it leaves me thinking, if individual support and resilience are so intertwined with social and environmental factors, how could we think bigger? How might we design broader societal support systems, maybe in communities, workplaces, even policy that don't just focus on individual effort, but actively build environments that make healthy choices easier and more supported for everyone living with chronic conditions like diabetes?